Okay, so today is all about incontinence in the female athlete. And so we're going to be talking about the types of incontinence that typically occur in that population, what to look for so you know really what type of incontinence they're experiencing, because that makes a huge difference on what the treatment plan actually is. And that's kind of the gist of today, knowing what it is, how to go about it, and so, yeah.
Okay, so hi everyone. This is Dr. Gopakumar here, and I'm the CEO of Core Physio India. So I invite everyone today for this wonderful session, Incontinence in Women Athletes, by Dr. Christianis, who is in the US and is one of the wonder physio. She's a physiotherapist, she is a strength and conditioning coach and a nutritionist by profession. Yes, and proud to have her here and delighted to have the whole delegates who's going to be here for this session. Yes, we have our Dr. Sunita Patel. Yes, so she is also a woman health physiotherapist, and she's a promoter, founder of VCAB Women. Proud to have you, Dr. Sunita.
Thank you so much.
Yes, and my whole team, Dr. Himanshu Tiwari, Dr. Kapila Jain, and Dr. Sharmila Devi. So I think due to some technical issues, we couldn't, start at the right time. But yes, hope everything goes well, and we could kick off. So Dr. Sunita, can you just say a few words so that Dr. Christie can start this session and go on with the flow?
Thank you so much for giving this opportunity and giving this platform as well to hold the team of core. And special thanks to Dr. Gopal, Dr. Kapila Jain, Dr. Dhanvantri, everyone. And Women Health, I'm Dr. Sunita Patel, Women Health Physiotherapist. And thank you so much, all of you, that you are taking interest and you are taking initiative to learn more about women health. As especially I'm a woman, and the best thing that I'm a physical therapist. So it is my privilege that I can understand more about female. It is not only depending upon that how old the female is. It is not only about the anatomy and physiology of understanding of the anatomy and physiology. It is about understanding the complete life cycle, and there are so many issues a female is going through. So nowadays, like pelvic floor is a very hot topic nowadays, and we can see that so many problems are there. And unfortunately, we were not having that much understanding about this in our curriculum, also in our syllabus, also that whole topic was missed. And this is a very important muscle for our core, and it is affecting not only a normal female, even athletes also. So today we are having Dr. Christine, who is going to put some lights on this topic. And believe me, girls, it doesn't depend that how old you are, what is your age, you are athlete or not, you are doing exercise or not. There are so many problems, and this incontinence, every female once in her life is going to, it is affecting once in her life. So very, very important topic, and I'm so privileged that you have given me this opportunity also to speak about that. To having Dr. Christine and to learn more from Dr. Christine. So I'm looking forward for this wonderful webinar, and thank you so much for sharing this platform with me. Thank you, dear.
Wonderful.
Yes, Dr. Christie. So now you can take over the session.
Okay.
And it is start. Yeah.
Wonderful. Thank you. I love all that you just said about the pelvic floor and how much that affects our whole bodies. Men too. Today we're talking about women specifically and women athletes. But obviously the pelvic floor, everyone's got one, believe it or not. We all do. Most people, when they think of incontinence, think of older women, and that's just part of the life cycle, and that's what happens. And as you pointed out, that is 100% not true. Now, women athletes specifically have just as high of a risk of incontinence as the non-athletic population. And women that are involved in higher impact sports, such as gymnastics, powerlifting, CrossFit, those types of things, actually have a higher incidence of incontinence than the general population does. So it is something that is out there. It's a lot more prevalent than a lot of people think. The other misconception that people have is that, oh, it's normal if I leak a little bit when I go to jump. And that is 100% not true. It is not normal to have leakage, okay? So there are specifically with this population, types of incontinence that I will see, or causes for incontinence, that are a little bit different and some similarities overlap in that general population. So the first thing to know is that the pelvic floor has a lot of work to do, okay? So the pelvic floor is part of our deep inner core. So it does help to support the spine. It helps us to move. And especially in conjunction with that diaphragm, it really helps to keep some intra-abdominal pressure going on. So it also helps to support some of those internal organs. So our bladder, the uterus, even the urethra and the anus, so that if you've ever heard of something like a prolapse, that's when those organs start to come down, and the pelvic floor really does do a good job of helping to support that and keep all those openings that are supposed to be closed. Okay, so we've got the spine function, the core function, the support function, and then it does help in sexual function as well. And we won't be talking a lot about that today, but there is a little bit of, obviously that's important in general, but when we're talking about some of the issue with pain and that being a cause for incontinence, some of the tightness, that does make a difference then. And that's one of the ways you'll notice if the cause is an actual tight muscle. So that just is the general function of some of those muscles. Now, in the female athlete, there are really, like I said, a few typical causes that are going to lead to some of that incontinence. Number one is going to be general pelvic floor weakness. Okay. And that's what you'll see in a lot of different members of society, but it can happen in the athlete too. So there are a few things to look for with that. This type of person typically will say, oh, I have leakage, obviously with doing their activity, whether it's running or swimming or, soccer or any of those activities. But then they also tend to have leakage in their everyday life activities. So that would be coughing, sneezing, laughing. Those are what we would call a stress incontinence, right? Where there's stress being placed upon those muscles. Or an urgency that comes with that too, meaning that I have to go, I have to go, I have to go. If I don't go, I'm going to have some leakage. So typically if there's actual weakness in the pelvic floor muscles, you get the leakage with the activity, but then also some leakage in everyday life activities too. So some things to look for besides, like I said, the leakage in those two areas would be if the person has a heaviness or pressure sensation, either in the pelvis or in the back. That's a sign of actual prolapse, and not always a sign of weakness, but there typically is a little bit of weakness that goes along with that. So that's number one to ask as far as a therapist goes. And this is any orthopedic therapist can ask these questions of their patients, okay? Number two, excuse me, I'm so sorry, would be if they did have any children. And that doesn't have to be now. That could be 10 years ago. That could be 15 years ago. Just the fact of having a baby, yay, ladies, increases our risks of having some pelvic floor weakness and some incontinence. Anybody that has undergone radiation therapy for cancer, specifically in the pelvis, that's going to weaken some of that tissue. And again, then will obviously cause weakness, in generalized weakness in those muscles. Hormone imbalance, and this doesn't mean for somebody necessarily an older woman, younger ladies too can have some of those hormones that are not in the correct function for what their bodies need. So typically a lower doses of estrogen and progesterone will thin out the vaginal walls and then again cause some of that weakness as well. Okay, so that again, like I said, is your generalized weakness. Okay, the second type is going to be over tightness. Now, where I see a lot of therapists go wrong is that they'll see, right, their patients have some leakage and they'll say, oh, you have to do these Kegels. Just do 30 Kegels a day and you're all set. If someone actually has tightness, you are doing them a huge disservice by telling them to do Kegels. So, and this is a demonstration you can use with your patients. What I usually tell people is if I were to walk around with my bicep partially contracted all day long, it's going to be pretty tired by the end of the day. And if someone were to hand me a 10-pound weight and say, do these 15 bicep curls, there is no way that arm is going to want to do that. Okay, so it works the same way with those pelvic floor muscles as well. So that if they're over tight, they're going to be weak because they're just working non-stop and they're tired. So how do you distinguish between that and if someone actually just has weakness? Well, there's a lot of other symptoms, just like that first group, that go along with this type of incontinence. Number one, believe it or not, they tend to have poor posture because some of those muscles, again, are playing a role in what's going on in that support. When somebody has that tight pelvis, they tend to kind of slump forward, and I'm just going to tilt this so you can see. These are shorts. And they also tend to keep their legs a little bit wider in this position because it's more comfortable for them to do so. So you'll notice right away on the initial evaluation with your patients that if they want to sit like that, that should set off a little warning bell in your mind right there. When somebody has that pelvic floor tightness causing issues, they also tend to have a history and usually current symptoms as well of hip pain, back pain, constipation, pain actually having a bowel movement. Sometimes they'll have, some deep abdominal pain too. And all of those are a sign that, okay, something is not just a weak muscle going on in there. There's something else that's causing, like I said, that tension to occur, okay? Stress also, and we all have stress. That's welcome to life, right? But some women, instead of holding stress here, will actually hold stress in their pelvic floor muscles. So if somebody is just high level of stress overall, which a lot of athletes can be, or if they have had a recent increase in stress in their lives and all of a sudden they're having these issues, that is definitely an area to check because, like I said, stress really makes a huge difference in all of that. And then lastly, this area is a little bit more sensitive, and you do need to have a good relationship with your patient before they probably would be willing to discuss this, but any history of trauma, and specifically trauma to that pelvic floor. So it doesn't have to be sexual abuse, but that is a red flag also for having some pelvic pain and tightness. But any type of trauma to the body is going to be a stress factor as well. And so that is another cause then of that tightness in there. And then lastly, the third cause is actually an imbalance in the inner core versus the pelvis. Now, most people think of an athlete and they think, oh, they're so strong. There is no way they could have any problems with any of this. And they may actually have a normal pelvic floor tone or strength. They may have good endurance, but their core muscles may be either so strong that their pelvic floor actually isn't keeping up, or their core muscles are not nearly as strong as they think they are, and then everything kind of takes over. So believe it or not, it's about 30% of people have no clue, whether you're an athlete, whether you're young, whether you're older, on how to activate those muscles. They think they know how to activate those muscles properly, and they don't. So you could do all the abdominal, all the glute work in the world that you want and think that it's going to strengthen those pelvic floor muscles, and it doesn't, unless you know how to do that properly. Okay. And so that is different, certainly, than just saying, oh, you have pelvic floor weakness. So I'm going to go through how, now you know kind of what to look for all of those things. And that, again, too, that group, that last group of people tend to be the people that will just have some of that leakage with higher impact, higher intensity exercise versus just all exercise. Anybody that is holding their breath or has really, high intra-abdominal pressure, that's going to be where you'll see more of that imbalance in the core. You can also test out their glute strength, their abdominal strength, right? You guys have different tests to be able to look at that. And if you find a weakness or you find something really strong in there, then you know, okay, well, there's probably a little bit of an imbalance between these two if it doesn't fit into one of those other categories. So that being said, what do, right? How do you help your patient without having to send them necessarily to another therapist? And there will be times when you do need to send them to a women's health specialist, but I want you guys to be able to help them right here, right now. So with that first group where everything is just plain old weak, you can help them learn how to do a proper Kegel without having to do an internal exam, okay? I'm going to take you through how to do this. And you want to make sure that you know how to do it first before you try to guide your patient on doing this. But I usually have people start, I'm going to stay seated for right now, but I typically have people start lying down because they are not having to fight gravity lying down. If someone can't get the feel of that, I will have them do it seated next, because you actually get a little biofeedback from the seat that you're on to help know if you're pulling against that gravity. So I start in, like I said, supine position. If that doesn't work, then I go into seated. So all you're asking them to do, you want to look at the whole body as you're doing this, because sometimes we get focused in on one area. You're going to ask, this is the cue that seems to work best for me. Please feel free to come up with your own cue as needed. But I tell people to think about that you are pulling a marble. Don't do this at home. I always preface that statement too, that you are trying to pull a marble up and inside just using those deep muscles. Now, that's just the first step, okay? So there are several things that you want to cue them on along with that. Number one is not holding your breath. Okay, that's probably the most common thing I see. So oftentimes, to really help, what I'll tell people first is take a breath in. As you exhale, that's when you want to try to pull those muscles in, okay? Now, because they form a sling from front all the way to back, people will feel it towards the butt a little bit, right? We're right around that sphincter. But what you don't want to see, and I'm not going to show you my butt, but you will see if I am squeezing my butt, they're going to raise up and down a little bit, okay? We do want to be able to make sure that you can isolate those pelvic floor muscles away from the rest of the core. So if they're doing it and they say, well, I feel it in my butt a little bit, but you're not noticing any up and down, then that's probably still correct, just because, like I said, those muscles do form that sling there. Okay, so breathing, have them try to do that contraction while exhaling. Watch for the glutes, and also watch for the adductors, right? If you watch somebody doing what we call the potty dance, what do? They kind of do this, and then they cross their legs and squeeze together. That's overflow, or a principle of overflow, trying to get those other muscles to kick in. We want to make sure they're not doing that either, okay? And then lastly, you want to make sure that they are not pushing out their bellies. I know that sounds funny, but that's an indication to know that they're not actually pulling in, right? We want to make sure that the diaphragm is working properly along with those pelvic floor muscles because of the anatomy, right? And where those are located and situated together, okay? If you don't feel comfortable talking somebody through this in an external way, that's when you would want to refer them to a pelvic floor specialist, because we do have some internal work that can be done to be able to know what those muscles are really doing. Because you can't look at, and like your bicep, you know what that's doing. You can't just look at your pelvis and go, oh yeah, I got it. Every once in a while, and this again, you may not be comfortable in the clinic with this, but I will have people take a mirror and look, and you can almost see a little bit of movement pulling up. You certainly can see, if you hold a mirror there, if you're pushing out, right? We want to avoid that pressure down. That's really, really important, okay? So that's kind of the general guidance. Really and truly, you should be able to do 10, just like any other kind of exercise, you should be able to do 10 repetitions, holding each for 10 seconds, okay? That's just, like I said, general guideline for basic strength. The other thing to keep in mind is that you want to make sure that your patients actually relax in between. A lot of times, if I were to hook somebody up to biofeedback, what I'd see would be them contract and it comes down a little, but then they contract again and then it comes down a little. You need to fully exhale and fully relax the body and make sure that everything is relaxed before you squeeze again. Or then you might end up in the second category of people, which is having that pelvic floor tightness, okay? And yes, you can over Kegel. I've had people, when I give them a specific set of exercises to do, that will come back and say, well, you know, I know you told me to do 20, but I was feeling really good, so I thought I would do them every hour. And you know, the weird thing is, I have pain, and I don't understand why I have pain. Just like any other muscle, if their body isn't strong enough to handle whatever sets, whatever reps they're doing, they are going to have, right, some small muscle tears, just like if you were weightlifting and did an excessive amount of weight or reps. So watch that too if they're starting to do that. So that's kind of the basic gist of, all right, somebody's got a lot of weakness, let's work on that. Now, the important part too, like I said, is that core strength. Make sure that they are really addressing that core with any of these, okay? We do want all of that to function properly. Going back, I'm just gonna put my hand to my stomach. Where I find, even us, right, what we tend to do improperly is diaphragm breathe. When I tell people to think about belly breathing, a lot of times I get this, just kind of a suck in with that, the rib cage. So to really do that properly, I tell people put one hand on your rib cage, one hand on your belly. As you take a deep breath in, you really want to think about filling up the belly, right? So you're pushing your hand out gently, but this hand isn't moving. So I'm not moving that rib cage. So that little gentle belly, and then exhale, let it go. So it's inhale, belly comes out, exhale, let it go. Now that technique works, like I said, is important in actually getting our body and our core trained. But I use that technique with people that actually have pelvic pain, truly any pain, because that's going to help relax the nervous system. And I know I haven't moved quite into that next topic of pain, but since I'm here on this one, you will find, again, if you were to hook somebody up, their pelvic floor muscles, you would see with that breathing that they slowly and steadily will get a lower resting tone after doing some of that diaphragm breathing, just the diaphragm breathing, no other exercise. So it is a really important one to incorporate in really daily life. Again, kind of like testing the Kegel and starting out with the Kegel, you may need to start in a supine position because it's easier to relax in that position. And a lot of times I will have people practice that in that position first. But life also happens. And so it's important to make sure that those muscles know how to function, right, in a sitting, in a standing, in that type of position. So that is, like I said, that diaphragm breathing. You guys probably all have a bunch of very cool core exercises that you do with your patients already to activate the abdominals and the glutes. And so you want to make sure that you do continue to do that. Don't neglect those pieces, okay? So moving on to that second part, like I said, with that pain, we already talked about the diaphragm breathing. Most people think, though, oh gosh, if there's all this internal stuff going on, what am I going to do, right? How do we help with that? Like I said, number one is that breathing. Now, with that breathing, you can actually add some hip movement, and that will help bring that tone down even more. So I'm going to just scooch this back. You can do this again. I always start lying down typically because it's a little easier. But what you're going to do when you breathe in, you're going to roll your legs out. And when you breathe in, you're going to internally rotate the hips. So it's breathe in, roll out, exhale, roll in. So again, if I was actually supine, right, it would be out, and then I'd even be more, you would see more of an internal rotation, certainly in that supine position. But I also have lots of patients that can do that very easily sitting down. You just need to make sure that they're relaxed and they're not just trying to rush through doing that exercise, okay? So those are two external exercises right there. Thirdly, you want to work on those hip rotators, okay? Those are attaching, some of those deep hip rotators, sorry, my table's moving, are attaching where those pelvic floor muscles are attaching to, and that tends to be why people have some hip pain that goes along with it. I find that there's a significant amount of tension in those muscles. So I have two hip stretches that I very commonly give to people. I am going to move myself down to the ground here so that you can see. You guys have probably done these before in your clinic, but I'm going to show you. One is that figure 4 pose where you're going to bring that opposite thigh up towards you. If that's too tight for them, I'll have people start with a cross and then just bring, not directly on the knee, right? We're pressing on that thigh, over towards that opposite shoulder to get some of that piriformis in there. And then the other one that tends to be neglected is getting that hip internal rotation. So if I want to do that same leg, I'm crossing the opposite leg all the way over and then dropping my knees now towards the right. Okay, so this actually gets the hip capsule a little bit more and the internal rotation as well. I think most of us know this and want to do this anyways, but we tend to neglect this, which again does play a role, like I said, in that pelvic floor function and discomfort. Okay, so sometimes that is all I have to do, and I never have to do any internal work for people. They do really well. I'll also have people use, I do not have people use a tennis ball on that piriformis anymore because of the sciatic nerve and where it runs, depending on the person, right? It can run on top, it can run through, it can run underneath. If that piriformis is tight and the sciatic nerve runs through it or underneath it, all you're doing is compressing that sciatic nerve by sitting on a tennis ball. Okay, so I have really pretty much completely gotten rid of that. I will have people, I have a Derma Edge, which is my tool, but I'll have people either use that or even just a rolling pin and lightly get into those muscles to try to get some fluid moving right between that fascia and the muscle, really just to get those layers gliding a little bit better, right? Improve that viscosity. So those are all external things. If that, oh, the other thing too, sorry. Sometimes people will have tightness in the abdominals, and that tends to come when you hear about the constipation. I will find that abdominal muscles get tight. So again, you can do some soft tissue work in there, right? Just some basic soft tissue work, which I know sometimes is uncomfortable, but it's important. And then even doing a little stretch, right? You can do some yoga poses where my shoes might be in the way, but right, you can do a cobra pose, a prone press up, however you want to call it. You can increase that and do some upward dog. That tends to actually feel really good. And then the other one I like, especially if there's spinal involvement, is that cat cow. So it's an extend, right? Lift that head up, squeeze those shoulder blades, arch that spine, and then round and tuck. As long as you breathe, it doesn't really matter what the breathing pattern is, just make sure that you have your patients breathe. And even if they have some discomfort with that, usually people can find one spot at least that feels okay to do that in, okay? If you have done all of those things and nothing changes that tightness, right? They're still having leakage, and the leakage is now truly, you know, it's because of that tightness. Again, that's when you would probably refer them to a different women's health therapist because they may need some internal work. There are things like dilators, pelvic floor massage tools, again, us doing our own manual work that will help to get to those muscles internally. But again, there's so much that you can do externally that tends to make a big difference. And obviously people want to do that much more than they want to try to do any type of internal work, whether it's with a therapist or on their own. So always doing as much as you can externally is a good option for people. So that pretty much encompasses the pain. From a therapist standpoint, you know, if you have any of your own favorite techniques that you like to use, oh, hip flexors, you guys probably guessed that one anyways. Those are the other muscle that tends to be really tight, right? Especially if there's any constipation or abdominal issues, because where does that psoas come up, right? All the way, right? About 3 fingers away from that belly button, diving deep to attach to that spine. So stretching out that hip flexor, again, excuse my moving all back and forth, but my studio here is, internet signal is all over the place. So I'm gonna come back onto the floor. Don't do this without a pillow. But I like doing, right, little tiny pelvic tuck, tighten those glutes because that helps to actually stretch out the hip flexors and then leaning into it. If you have someone that can't kneel, you can easily do this one standing as well. But activating the glute at the same time does get a better stretch into that hip flexor. Okay. All right. So moving on from pain down into the, right, the imbalance there. So number one, if they've already know how to do a Kegel, right, they've got some good strength. So you say, okay, pull in that marble, and they go, oh, yeah, that's easy. I can hold that for 10 seconds, not a problem. Right? No tightness, no pain, great. Their basic pelvic floor strength is normal. What they probably are having a very difficult time doing is activating it with their actual athletic, okay? So one of the first things I see is that people tend to hold their breath when they're doing something really intense. We all know we're not supposed to do it, but how many of you guys have probably found yourself being like, oh my gosh, I totally forgot to breathe. I better make sure that I do that. So that is huge. You do need to make sure that you tell them they have to breathe when they're lifting, when they're running, whatever, jumping they're doing. Otherwise, you're putting too much downward, you're increasing the intra-abdominal pressure way too much, and those pelvic floor muscles can't support that either, okay? So that's step one. Make sure but they are actually breathing. Focus in on the diaphragm breathing a little bit too. And then when you're adding some of those basic exercises you do, just like if you were to try to get somebody back into running, right? We don't start with jumping and running. You start with your basic strengthening whatever needs to be strengthened. Some of my kind of go-tos to get those muscles functioning a little bit better would be having them, and this is a progression here, okay? So step one would be, okay, can you do your Kegels sitting? And if you can you do that and then go stand up and then let it go? If they can, they'll be able to let it go and they'll feel it letting go after they've stood. If they're not able to do that, what will happen is that they'll try to do a Kegel here, they'll stand up and they'll go, oh, shoot, I have no idea. I'm not sure if I'm still holding that contraction, okay? If that's the case, I start them on a wall slide, which is a little bit easier to do. You're still fighting gravity. Even backing it back down and just having them start doing them standing. Start doing them with walking, right? We have to be able to get them, those muscles have to work in order to do the activities that they need to do. So that sit to stand, again, after that, I would typically go into just a basic squat, okay, right? Having them, so now we're starting in a standing position, which is a little harder than that seated position, doing that little contraction and seeing if you can hold that through that whole squat and let go at the top. You want to make sure, just like I said, even with the basic pelvic floor strength, that they relax those muscles in between each repetition so that you're not at that constant high level of tone, right? Really, really important there. Moving on from the squat, I then tend, and this is for anybody, right? This is for any athlete, not just a runner, not just a swimmer. We want to make sure that we're just progressively making those exercises harder and harder. So I tend to then from there, go into a little bit more of a lateral move. I can't see my knees totally, but I'll come down there a little bit. So into a lateral lunge and have them do that same thing, because now we're not single leg yet, but we're more on one leg than another. And like I said, we're going lateral a little bit as well. And so that tends to be a little bit harder for the body to do, because how much motion do we ever do in a side to side fashion? Very, very, very little. From there, and please, by all means, if you have favorite exercises, like I said, you can certainly have them add those in. But after that, progressing into those single legs. So whether it's a single leg, and these are just the basic exercise things, right? But we're adding that pelvic floor contraction, single leg deadlifts, single leg chops are always good, single leg squats. And then you can get really fancy and start to add some band work. From there, that's when you want to start to think about doing that jumping, okay? So again, just like a regular progression, like an ACL would be, you're going to start with 2 feet and you'll go to 1 foot. You do want to make sure, let's say they are a power lifter, you want to make sure that you're adding weights to that, not just the body weight, because they have to be able to use these muscles in conjunction with whatever activity it is that they're doing. So that is where your kind of creativity will come into play. Figure out what sport it is they're doing, what motions they need to be able to do. But starting with the basics and then progressing to double leg, lateral, single leg, double leg jumping, single leg jumping. And again, where the other issue I tend to find is people that are overhead athletes, whether they're softball players or baseball players, or again, you're just talking about lifting or CrossFit, there's just a lot of stress that gets placed on the body. And you guys know that with the spine even, right? Even just adding overhead motion is a challenge to the spine. So adding that in is important then to get those pelvic floor muscles to incorporate with that as well. If you feel not comfortable adding that whole progression on there, again, right, that's when you would refer to another women's health therapist who can help put them through some of that. But I oftentimes guide people through this stuff and they do just fine without needing to come actually see me. So there really is just a lot of stuff that you can do in the clinic. So that really is kind of the general overall basic guideline clinical procedure that I would use. Again, I obviously do some of the internal work if it's needed, but the exercises that I just showed you guys are all the ones that I would have you do, I would do myself in the clinic too. Does anyone have questions? I know I talked very, very rapidly. I just want to make sure that I have answered.
Yeah.
Oh, hi.
Hi, Christy. It was a very great session with a couple of, I think, yes, you have covered up a couple of muscle groups, which, hello, is it
Yes.
audible? Yeah. So I
Yep.
think you have done a great session. I think hope everyone would be benefited by this. Yeah. But there are certain couple of questions which has come in. I think Dr. Imanshu Tiwari, could you please come out and
Yes, sir.
just yeah.
So am I audible?
Yes.
Yes.
Perfect. So it was really a wonderful session, and we really enjoyed the precise knowledge and the technique you've demonstrated. We've got a couple of questions over there in the chat box. It's a question which says, how to check muscle tone imbalance?
So, do you have a test in your clinic that you will use to look at abdominal strength or glute strength?
So it's actually on the comment box on the YouTube. So probably
Okay.
we could take it as yes.
Okay, so what I typically tell people is, again, we all have learned different muscle testing and different strength testing, right? But I tend to ask people to be able to do a couple different abdominal motions. One is a plank. It's not my favorite of abdominal motions, but it's an easy thing to look at the clinic. What the norms are for each age, I couldn't tell you off the top of my head, but that is information you can look up. Glutes, I tend to have them do single leg bridges, 20 to 30 single leg bridges. And if they can feel that in their butt and not as much in the hamstring, the glutes are activating well. You can certainly do the manual muscle test on your stomach where you lift that leg and press down, but it's not very functional. So I tend not to do that. The other one I'll look at for the abdominals, and I don't ever give this as an exercise, is have someone lying on supine, bring their legs up and see if they're able to lower it all without pressing those abdominals out, without arching that spine. Again, because that's a significant force through the spine, I don't ever give that as an exercise. Sometimes I'll even start with just, can you lower one leg and activate there? Everybody should be able to do that. If they can't do that, then I'll ask them to do it with a bent knee. And again, if they really can't do that, then you really need to get some basic abdominal strength going on. And can they activate that transverse abdominis as well, right? Which is just kind of that, it's really pretty small. It's almost like if you were to go to get hit and you kind of pull in, but you don't suck in, right? You want to brace down here, not here. And sometimes that's a coordination thing too. I think that answers that question.
Thank you so much. There's one more question which says, how can we be very sure that the PFM is tight? So is there any sign or symptom or test which can confirm this?
Yeah, so like I said, if they are able to do 10 repetitions, holding 10 seconds, that generally means strength is relatively normal. Now you can't look, right? You have to go on their reporting and making sure, like I said in the beginning, that they're not adding in all of those other muscle groups. That's if you're really not sure, you would need to send them off to have an actual pelvic exam. But 10 repetitions, 10 seconds, roughly is normal. You also want to check to make sure they're able to quickly contract and let go. So that is literally a forceful contract, let go, contract, let go. And again, if you can see me doing it, what you don't want to see is this, right? You don't want those glutes to go up. So just that contract and let go.
Great. We've got one more question, and the question says that, does these strenuous exercises induce constipation as well?
I'm sorry, what was that about constipation? I didn't hear the first part.
The question was, does these strenuous exercises induce constipation?
They should not. So the strenuous exercise, I guess what I'm not sure of is if you're talking about the exercises that you're using to treat the issue, or the strenuous exercises that people just would do on a normal basis.
I guess the question was not complete. I would take that as the protocol which we would be following for the incontinence.
Yeah. So just like with the basic stuff, you need to make sure, that's why the relaxation component is important, right? If muscles are tight, that tends to be where the constipation becomes more of an issue. If the muscles aren't working, you actually not only can get bladder leakage, but you can get some fecal leakage too. So you just want to start with the basics. If they know how to activate properly, then you gradually add some of these steps in, making sure that the basics are applied. The muscles are relaxing in between. They aren't holding their breath or using any of those other muscles. So it's just that step-by-step process.
Great. I have one personal question, as I too work with the athletes and professional players, and fortunately, I'm assisting two women teams as well. So I've seen a pretty challenging scenario with women athletes in certain high stress situations within the match. They tend to experience incontinence. So that is an induced incontinence, I suppose, because they are not facing specific issues with the muscle groups or the compartment, but due to stress situations and high pressure of the match, probably they experience such kind of trouble. So is there a way to condition ourselves, or is there a protocol which can help us reduce the way the stress induces the incontinence during the match? Because it gets really tough and challenging during the match. You're actually into it and you experience something, you immediately lose confidence, you immediately lose control on it. So if we can get something which can immediately help us and reduce this kind of activity, so that will be helpful.
So unfortunately, there's nothing immediate.
Oh.
Number one is that actually some of the muscles, and I didn't mention this in the beginning, but some of these pelvic floor muscles can get damaged from overuse from high stressful activities. Once there's damage, and you have to just relearn how to use those muscles along with your sport. So it really, unfortunately, goes back to, you need to make sure those lower level activities and movements, they're able to contract and use those muscles. And then that step-by-step progression again of, all right, let's try a little bit more difficult exercise, a little bit more, until they can get to their functional sport exercise of using those muscles. If they can't utilize them in a lower level, there's no way they're going to be able to be on that mat and use those then. So unfortunately, it's not a quick like, oh, just do this and you'll be fine. It doesn't tend to work that way.
So, but the muscle groups, they are damaged, as you said, that because of overusage. So they should share some kind of signs or symptoms earlier as well. But such situation occurs in high stress scenarios only. So like if they are into a very high intensive match, right, and they're performing good, but all of a sudden the pressure gets developed and they experience such kind of insufficiencies and incontinence. So is it more of a psychological driven, or is it
Great question. So it can be, right? If you get stressed, number one, you automatically start to change the way you're moving, right? What I see a lot of times in a highly stressful physical or mental situation is that people will hold their breath, right? So that's number one. That's going to increase issues. So make sure they're breathing. But you are right about the psychological aspect, especially if they've had this happen before, right? They've had an event and they've had some leakage. That's going to be in the head to be like, oh no, here we go. I know I'm doing this move. This happened last time. Automatically they think, oh boy, this is going to happen again. That is a very valid, very great point. So that as a physical therapist is very challenging to address. And that's where it does take a bit of a team approach sometimes, right? To make sure that you're getting mental, physical, whole body in tune with that. That was, very good point.
So correct me if I'm wrong. So probably we can create something which can help us to lower down the trigger stimulus and induce some kind of trigger reflex in the body, so that we are able to manage with such situations. So is there a kind of any kind of biomechanical correction or a kind of kinesthetic situation which gets created, and we can induce it in the training protocol? If we can, is there something?
So a lot of times, obviously, I'll start with breathing, right? You want to make sure before the match even starts, just to have them get in the right mind frame. And this, honestly, I use a lot of meditation with my patients to practice that, not necessarily during sport, but away from sport, to help them get in the right mindset. So I think that is in our wheelhouse to be able to address. Number two, I will have them do a longer holding pelvic floor contraction Because just like if you were to have somebody, right, do like an active release or a trigger point release on somebody, you're basically overstimulating that muscle. So if you can do that, that then will help calm down those muscles a little bit too, so that they're not doing this in that stressful situation. That generally works best if you can do it literally right before. But sometimes you have to do it before the competition, not before the move, right? So those would be things that I have tried with people that do tend to work. But again, it does take a lot of work off the mat, as opposed to, okay, we're right in the situation, right? Just like anything else, you have to practice all that stuff before you get to the really stressful physical and mental situation.
So a kind of a partial kill routine can help us before the match, and we can condition the muscles and reinstate their tonicity, and that can help us.
Yes.
Perfect.
Yeah,
It was really amazing. Yeah. Thank you so much, Christy. It was an amazing session, and many facts have unveiled, and it was really a great insight to learn. And thanks for you being here. I would request Dr. Kapila to step forward and express her views on the session today. Dr. Kapila Jain. Dr. Kapila Jain, is she here? I guess probably due to network, she might have got dropped. Dr. Sharmila? Well, I guess there's some kind of network game going on. So it was really a pleasure, and we are blessed to have you here with us. Thank you, Christy.
Well, thank you for having me.
And I really thank Dr. Sunita for taking out a lot of time from a precious and strenuous routine. So thank you for being here, ma'am. And I request Dr. Gopakumar to please step forward and express his views. Thank you.
Hi. Yeah, so it was thanks to Dr. Christie for answering our queries. Hope we have not disturbed you much, I think, in the busy schedule. And I think, yeah, Dr. Sunita, if you have some from your side, you can just put on
Thank you so much, Dr. Christine. It was very nicely explained that even you have explained, not even theoretically, even practically, you have demonstrated the exercises, which is going to help our physios to understand, and which is going to give us a bit understanding about how to, perform before even starting our sports activity, and how to train that those muscles. Either the muscles are tight, so how to relax those muscles, and if the muscles are very loose, then how to strengthen those muscles, and how that breathing is playing a very important role during activation of that particular muscles. It is very fantastically explained by you, and the demonstration of those very nicely explained exercise protocols was also very nice. Appreciated. Thank you so much, Dr. Christine.
Thank you very much.
Thank you, dear. Thank you. Over to you, Doctor.
Thank you so much.
Okay, so I think we can invite Dr. Kapila Jain to just Dr. Kapila Jain. Is she there? So she can say some few words and we can close the session.
I don't think she's.
Dr. Kapila Jain. I think
she's here.
Due to some network issue, she's not there. Probably the call has got dropped from her side. Yeah, I think she's not seen. So.
She's there. Okay, so yeah, so then I think Himanshu can, on behalf of Dr. Kapila Jain.
Sure.
Yes.
So on behalf of the entire cast team and Dr. Gopakumar and the entire cast team, I thank you, Christine, and thanks for being there. I know you are pretty busy. You've got prior commitments as well. Sorry for our delay because we started a bit late due to the network glitch. And it was really a pleasure having you. And we'll be looking forward for more such insightful sessions from you. So yes. Thank you and regards. Thank you. Thank you, Dr. Sunita.
Thank you. Bye.
Take care, everybody.
Thanks a lot. Thanks a lot, Dr. Christine. See you soon.
Bye.
Bye.